Hi guys, so welcome back to my channel. My name is Stephanie. If it's your first time coming across my channel or seeing my face, I would like you to do three things for me. Please like, subscribe, leave a comment in the comment section and share. Okay, so we are here to have some fun, and in today's video I will be comparing giving birth in South Africa and giving birth in the UK. My personal experiences, okay? Disclaimer, I'm not talking for everyone. I'm talking what is particular to my experiences. So let's jump right into the video. First of all, I'm going to talk on food, personnel, clinic visits, finances. I'll touch a little bit of everything so that you can have an idea of what it is like giving birth in the UK versus South Africa. Okay, so let's jump right into the video. First of all, we are going to talk of health insurance. When I gave birth in South Africa, I had a health insurance. Okay, so it is common for you to see people who buy health insurance so that they can cover them, especially when you have to give birth in South Africa as a foreigner. Especially giving birth in South Africa, you will need health insurance to cover you. And if you do not have health insurance, I'm telling you, the amount of money you're going to spend, you'll be like, what is going on here? So yes, so as a foreigner, for me, in fact, that's one of the requirements before entering into the country, because I came through a spousal visa. You will need a health insurance. Like, you don't, that is non-disputable. So I subscribed with one. I don't know if it's free ad for them, Bonitas. That is the health insurance that I use. But here in the UK, you do not need health insurance for whatever. This is the, how can I call it? The healthcare here is free. You don't need to pay for anything, in as much as you came in here legally with a visa. You need nothing. You just register with NHS, you get a hospital number, and that is it. Yeah. So let's talk about clinic visits. Sorry guys. So in South Africa, when it came to clinic visits, who guys, when you go there, you obviously have a file, and then they'll give you a booklet where they write your next appointment. And for you to come and be received on time, you have to get up maybe at 3 o'clock or 4. Maybe I've over exaggerated saying 3 o'clock. Yes, because there was a time we left the house at 5, and getting there was a long line already. So you have to leave your house very, very early, depending where you are. I gave birth at that hospital in Waterfront. I've forgotten the name. It's a public hospital anyways. So my hospital visits were in the same hospital. So by the time you are getting there, if you left the house very early, me, I've never been lucky enough to come and I'm the first to be received. No matter how early I leave the house, I'll still come and be like 30 something. I'll meet a very, very long line. So they have lots of midwives there, doctors. You see a midwife. First of all, they arrange your you go collect your file, and then you go give it at the window. Then they tell you, I don't know, they take your name and they'll call you in to come and give your pee sample. From there, you have to go now and wait on the line so that the doctor should receive you and check check the baby basically. But here in the UK, it's so stress-free, guys. Like, it's the best for me. Sorry if I said it's the best, but I'm not trying to shoot down on South Africa. It's just my experience. Okay, experiencing both, I can say the one here is easier, because here you have just one midwife following you. You have her number, you can call her at any time. If they tell you, because they used to send me text messages of when I have my appointment. They'll say, maybe I have an appointment today at 10:15. So the previous day they will send you a message to remind you, like, you have an appointment tomorrow at this time in this clinic, so with your midwife. And when you go there, that exact same time she receives you, highest 5 minutes, you are done. There's no waiting on the queues for long. There is no stress going up and down. You come with food in your bag because you are going to spend the whole day there. Yeah, so that's how it is here in the UK. When you're pregnant, you have just one midwife. She follows you up, and if there's any complications, she can refer you to a doctor. Like, when in my case, if you have watched the video on gestational diabetes that I put out, she's the one that discovered I had gestational diabetes, because she took my pee sample and then bloods, and they sent them to the lab, and from there she referred me to the hospital. So she followed me up until I gave birth. Guys, I'm sorry about the blabbing. Yes, she followed me up until I gave birth, and that is where our journey ended. And up to now, I still have a number. So I want to talk of the relationship between pregnant women and the staff that is following them up here in the UK versus South Africa. you notice that in South Africa, everything is just business. There is no like, I don't know if it's for, I'm saying from my own point of view, because I felt like I wasn't, no matter how you try to be friendly or close to them, there's that gap. They give you like, sissy, no, 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 sissy. So I don't know how to explain this without annoying people that will be watching this channel from South Africa, but I just want to leave it at this. I don't want to involve emotions. So I want to say the relationship between the pregnant woman and the doctor, for me as a foreigner, I didn't feel like there were, like the gap was breached, you see. But here in the UK, they make you feel so comfortable, like you can open up to them about your anything that is disturbing you. You can open up to them. They'll ask you about depression. Are you depressed? Is everything good at home? Is your husband supportive? Is like they follow you up to make sure that you are living in the best conditions in your home. You can call them at any time if you feel like everything is not going on well. If you feel I'm not saying that's what I did, but if you feel your partner is stressing you up and you need space, you can call them up and they'll sort things out. But how did they sort things out? I don't know, and I don't even want to find out, because my husband was just so supportive. Since we're just so opposite, he has to support me. If not, who will? So that's what I mean. Maybe I've not put my words correct, but I just want to say, like, they need to gap that bridge. They need to, sorry, they need to bridge the gap that exists between patients and doctor in South Africa. Like, you should make your patients comfortable enough to open up to you. Like, talk to them, be their friend. Don't just be like, I'm the doctor, you are the patient. I ask questions, you answer. Is there any question? No. Like, the atmosphere is so tense, but here, like, everyone is on the same level. You discuss like friends. They ask you, they even scan you without you being known that you are being scanned. Yeah, so that is just what I want to say. I don't know if I did put my words right or not, but yes. And it's so liberating to have someone to talk to, especially in such a difficult moment like pregnancies. Going to talk on vaccinations. In South Africa, they give you vaccines to take during pregnancy. If I can remember, I think I took just one vaccine in South Africa, and that is it. I don't know if it's because I was using the public hospital. I don't know if it is different in private hospitals, but if despite me having a, how do they say, health insurance card that I was using, they saw it at extra charges and they had to bill my insurance for that, and it didn't cause me any problem. So yeah, they did that. And here in the UK, they propose vaccines. They tell you you have to take, like for in my case, they said I have to take a whooping cough vaccine, I have to take a flu vaccine, I had to take COVID vaccine, I had to take which vaccine again? But I didn't take all of them. I just took the whooping cough and but I didn't take the, how they say, the COVID vaccine, because I was too scared. I remember taking it in South Africa, and what it did to me, I didn't even want to, so I just ran away. They don't force you to take any vaccine. You can decide whether or not to take it. And they explained to me like what was most important for me to take was a flu vaccine, because they said it will protect, I it will protect you, you and the baby from flu and cold, especially after you give birth. And when they explained that, I accepted it and I took that one. But for COVID, my experience was not the best, so I had to like, no, thank you. So we're going to talk of postnatal care. So after giving birth in South Africa, you have to take your baby to the hospital for hospital visits. The first, I don't know if it was the 2 weeks after giving birth, you go back to the hospital for the vaccines, and from there they start booking you for subsequent visits, which is way contrary here. Like when I left the hospital, they gave me a booklet with numbers to call, because the next day someone was supposed to come see me within 24 hours of leaving the hospital. They say if by this time the midwife that is supposed to come see you doesn't come, give us a call and we'll know what to do immediately. These are important visits that are, you have to receive these people. They have to come to you. If it is your responsibility to call us if they don't come, so that we can dispatch someone urgently. And so far so good. They have been coming. I think I've received like 5 visits. Is it 5 or 4? I'm not counting, guys, but they have been coming. The nurses have been coming. you see the same faces twice after they disappear. Some come just once, yeah, and it has been good. When they come, they check on you. How is everything doing? If you had a wound during birth, is it healing properly? Is the baby okay in the house? What is there in the house that you need to get rid of? Do you have a partner who smokes? Do you, they check everything to make sure that the baby is growing in a healthy environment. Yeah, I like that. Here in the UK, you have the opportunity to decide what you want your birth plan to look like. And in SA, I don't remember having that option of you deciding what you want when you are giving birth. Like, do you want your partner in the room, like in the theater? Do you, just for you to choose? Do you want male staff there? Do you, you choose what you want here in the UK, but in South Africa, we're not given that option. Maybe, but this is still also a government hospital in South Africa. I also used a government hospital. I could still use a private hospital regarding the fact that I had medical insurance, but due to bad experiences from people around me who used private hospitals, they didn't really encourage me to go there. Like, the nurses were negligent, and one almost lost her child. They say government hospitals in the UK are the best to give birth, and which I must say, yes, they are really, really good. I experienced like a private hospital once, and the experience was good. When I had my mectomy, I went to a private hospital, and it was also good. But since people complained a lot, people around me, they were like, private hospitals, you better take your medical insurance and go to the government hospital. You will receive the best services. The only thing that I would say that made me feel like how do I say, that made me feel like they need to fix this, is just the fact that you have to come and wait in line, and that is basically it. Apart from that, if they should remove that waiting in line process, everything is fine, because it is free. You don't even pay anything. And here in the UK, it's also free. In the UK, it's not as free as they say it. If you come here legally, remember there's a health surcharge that you pay, which covers everything medical. I don't know if I'm making any sense. Like, there's an amount of money they ask you to pay for your health surcharge, which covers everything that within the period your visa is covering you here in the UK. You'll be covered in case of an emergency, or in case of anything. If you are sick, you'll be covered without spending money. Because if you have to spend, will you be able, thousands and thousands and thousands of pounds, which I think is very good, because you have access to everything. You can do any test you want to get treated for any condition, and it's just good, guys. It's good. And it's the same thing also in South Africa. I can't remember getting sick and then going to the hospital and they ask me for money. It is also very good. How I wish my country was like that. Because in Cameroon, you have to go for maternity visits, you take money because you have to pay for one or two things. You have to I don't want to go there, because I didn't give birth in Cameroon. I don't have a child in Cameroon, and I've never given birth in Cameroon. So I wish I had experienced that, so that I can also compare the three experiences to, But for what I hear, every time you go, you have to pay. You pay for stuff, and echography, you pay, scan, you have to pay. Like, it's just money you spend all around. And it makes women who live in very poor condition to give birth in certain conditions. Some even give birth at home, some even, it's okay. Thank you, guys. So I'll be talking about the food they provide when you give birth in the hospital in South Africa. I spent 3 days in the hospital, which is about the same amount of time I spent here when I gave birth also. So 3 days in South Africa and 3 days in the UK. In South Africa, the food they give you balanced diet. They give you veggies, and they make sure you have some protein and a little bit of carbs. Yes, and it's also the same thing here in the UK. And for the tastes of food and how it is preferred, I would say I prefer more of the UK food. Okay, this is because the food is served warm. In South Africa, the food that they gave me there, it was always cold. I don't know if they dish it and leave it out for long, but it was always cold. But here you are served warm meals, and in the morning you take care of your breakfast. In both cases, Yes, but the only difference is that here in the UK, you go to the kitchen, you can make yourself a sandwich and a cup of tea. You can go as many times as you want. They have biscuits, tea, and juice dispensers. You can, in the morning, you can just go to the kitchen, make yourself a breakfast, because each ward has a kitchen, a bathroom, and your own little space where you can just go get your stuff, come to your space and eat, because it is covered. It's not open. It is covered to give yourself some privacy, and that is nice. Like, the staff there was good. Like, in both cases, the staff, yeah, they do their best in the hospital. They make sure all the patients and all the kids are fine. So yes, I would say both experiences are unique in their own ways, because if you are given the circumstances in South Africa, I would say for an African country, South Africa is really doing good. Like, South Africa is, it needs to be applauded, because the level where they are now, from where I come from, it would take us a number of years, like decades, thousands of years for us to reach there. I know what I'm talking about, and I don't want to go into details. And here in the UK, like, it's just me. It's my first European country, and I'm just so impressed. So, to each their flowers. I love you so much. It was such a beautiful experience in South Africa, and in the UK, I also enjoyed the experience. So, if you have watched up to this moment, I would like to thank you so much for sticking around. Thank you for not clicking out of the video. Thank you for watching till the end, and I love you so much. Bye. See you in my next video.